I'm going to ask you first, how did you start or what got you into breathing? Because there's not so many GPs with an awareness of breathing. I think it's great, but how did you start?
So partly I became quite disillusioned with medicine probably about 8, 9 years ago. I didn't feel I was helping patients as I wanted to. I just became a doctor because I wanted to help people, and people are complex, and a lot of complex problems, traditional medicine can run out of options. And then along that way, I went down a really unstructured journey learning about mindfulness and neuroscience and mind-body breath connection. But then I started snoring. So in my perimenopause, I started snoring, and I really didn't think there was any problem with my breathing at all. I was running 3 times a week. But in retrospect, I know now that when I was about 10, another pupil in the playground told me to suck my stomach in so it wouldn't look as big. And I think I probably stopped using my diaphragm at that point. And I think women don't realise that if they're holding their stomach in, it affects their breathing. And your diaphragm, that main breathing muscle under your ribs, it's a muscle, and if you don't use it, it gets weaker. And then you start to breathe more upper chest. And then as you go through medical school, you get a bit stressed. So I probably started breathing more upper chest, mouth, fast. And then I talk a lot for my living, which is not necessarily very good for breathing. And then the tipping point for me was the changes around the perimenopause. And I'm really lucky that obviously I came across your work, and I essentially, with your help, retaught myself to breathe as nature intended. My snoring stopped, and like my functioning so much better. You know, I feel calmer, I can exercise with greater ease, and my sleep is just the best it's ever been. And obviously, I want other people to know about that. It's a piece in a jigsaw of health and well-being. I'm not saying it's relevant to everybody, but if you don't know about it, you can't assess whether it's relevant to you. But actually, it's way more complicated than that. We can breathe efficiently as nature intended, or we can breathe inefficiently or anywhere in between. And I clearly started to not breathe efficiently probably around 10, and it just slowly deteriorated. And then when it hit the tipping point, that's when I noticed. And I think in medicine we separate things. So we separate things into how, one aspect of respiratory medicine is how we breathe when we're awake, and one aspect of sleep medicine is how we breathe when we're asleep. But we're not an awake and an asleep person. We are a whole person. If I'm not breathing efficiently, because I've got breathing pattern disorder when I'm awake, it's highly unlikely I'm suddenly going to start breathing efficiently when I'm asleep. So to separate the two just doesn't make sense. And obviously, as a GP, because I have to have that holistic view, it probably is a bit easier for me. And obviously, I've been on the receiving end of it as well. And I've noticed, when I changed how I breathed when I was awake, it really helped my breathing when I was asleep. And I'm not saying, you're going to cure all obstructive sleep apnea by changing breathing patterns, but it's just the basic natural foundation to make sure that someone's breathing efficiently. And I think, the more chronic disease that people get, in the 3 hormonal transitions of life, women's breathing changes, and people don't know this. I didn't know this as a doctor. So at puberty, pregnancy, and menopause, we're more likely to get a blocked nose. So puberty rhinitis, pregnancy rhinitis, and menopausal rhinitis. And if people don't know the importance of breathing as nature intended using the nose, then they'll start to mouth breathe. And the more you use your mouth to breathe, the more your nose gets blocked. And then it's just a vicious cycle. At puberty, before puberty, we've got more boys than girls have asthma. After puberty, we've got more girls than boys. We need research on that. What do we do to girls when they go through puberty? We put a bra around them. We're actually restricting their breathing. Do we need to rethink that? Do we also need to think about girls that, if they're getting embarrassed about breast development and they're starting to sort of hide themselves? Actually, that's going to restrict their breathing. We need to talk about that. Perhaps that should be discussed in schools when they're having their, education around periods, etc. When women go through pregnancy, there is a steep rise in sleep disorder breathing. And I think, if anyone's been pregnant and carried a baby till around term, I don't think any of us would say that breathing is like as good as it was when we started it, when we were just before we were pregnant. We know how difficult it is to breathe when you've got a baby inside of you, for various physiological reasons. But again, if you start that pregnancy and you're breathing this fast at rest, you're going to hit that tipping point sooner than if you'd like, oh, shall I improve my breathing? And I'm here, and oh yeah, my breathing will deteriorate, but it won't get to the point that I'm snoring and got obstructive sleep apnea. And I can delve further into, there's a little bit of work on that if you want to go into it. And then obviously with menopause, for different reasons, there's a steep rise in sleep disordered breathing again. And so all these hormonal changes are affecting our breathing. And I would love women to know, at these hormonal changes, my breathing might become more inefficient. Can I assess my breathing before and work on it if it's not as efficient as I thought it was? And that might actually help those transitions. But obviously that information isn't out there yet. So,
And some of our listeners will be familiar with overbreathing, but some may not. And the concept of overbreathing, because we think oxygen is good and get rid of the toxic carbon dioxide. Can you just explain a little bit about the physiology that breathing is not necessarily what people may at first glance think it is? So where is the balance there?
So generally, we only need about 6 litres of air per minute. And actually, some people with asthma who are poorly controlled can breathe 14 litres of air per minute. I mean, I actually measured that out for a social media post. It took me ages to fill up 14 litres, and 6 litres was really easy. And to me, I thought, oh my goodness, how difficult is it for someone to breathe that volume per minute? I mean, that's crazy. But essentially, we don't need a lot of air. And if people just think of this concept that when at sea level we breathe in and 21% is oxygen, but we breathe out and 16% is still oxygen. So we haven't used up all the oxygen. Even when we're exercising, it's not zero on the exhale. So if anybody hears the phrase, take a big breath to get more oxygen, it doesn't make physiological sense because we're throwing out oxygen we're not using. The issue is getting the oxygen from the blood or on the blood cells into the tissues. And actually that involves different things. It can involve heat, carbon dioxide, and something that we make with regard to altitude training. So, but I think the big thing is, our waste product carbon dioxide actually helps release oxygen to the tissues. So actually, the more tolerant we are to our waste product, the more our body will release oxygen to our tissues. And I think we've lost that. Well, I knew this. I was taught this at medical school in my first year. And when I did my breathing practitioner training with you, I actually went back to my 30-year-old year textbook. I was taught this. Why wasn't I taught the practical applications of it? So air hunger, that feeling of suffocation when we hit that carbon dioxide tolerance, it's not necessarily a bad thing, and we can train that to be better. And I think it's profound. It really makes a difference to people.
And I think it ties in as well with the conversation that you had. So say, for example, hormonal changes, and especially the likes of progesterone, that it stimulates respiration. And the female then is breathing faster and harder and putting her into overbreathing. But you said if her everyday breathing is pretty okay, and then when there is an increase in progesterone, yes, her breathing will increase, but she'll still be doing pretty okay.
Yeah.
It's when a female doesn't have good breathing. And the next thing is there's an increase in progesterone.
Yeah.
So there's poorer breathing on top of already poor breathing, and that's going to put her into symptoms. What symptoms could be caused for females, or what might they experience if they have times of overbreathing?
So I think this is really, really interesting. And certainly, if we've got listeners that have premenstrual tension, they're really struggling with the perimenopause or progesterone intolerance, just consider, could it be related to how I breathe? I'm not saying it is, those are complicated areas, but exactly what you say, it's completely under-recognised that progesterone is going to make you breathe faster, and does that tip you into symptoms of hyperventilation? And when you look at the symptoms of hyperventilation, they're very similar to symptoms of the perimenopause and premenstrual tension. So, you know, things like brain fog, pins and needles, an inability to feel like you can get air in, fatigue, poor sleep. Gosh, I'm struggling now.
Yeah, increased pain,
Or increased
headaches.
pain. Yeah,
Yeah,
complete.
anxiety, panic disorder.
Absolutely. So all those things, is it related to the hormonal changes, or has it just tipped you into
Mm.
breathing so much that it's tipped you into those symptoms? It's just a question, and for people to think about, but I think really important.